Good morning, everyone, or afternoon on the East Coast. Welcome to our third webinar in this series on our resource guide for mental health professionals working with youth in the juvenile justice system. Today, we're going to be talking about screening and assessment in the juvenile justice system. My name is Carly Bates, and I'm very excited to have a really exciting and interesting webinar today with you all. So just to orient you, right, the Center for Trauma Recovery and Juvenile Justice, or CTRJJ, supports a comprehensive framework for developing, adopting, and implementing and sustaining evidence-based trauma-informed services for youth who are in or at risk for involvement in the juvenile justice system, as well as their families. So the CTRJJ is putting on this webinar today, and we welcome all of you. So just a couple of housekeeping and reminders. Please submit your questions using the Q&A function. We're going to be having primarily a panel today. We'll address as many questions during the webinar as we can, and then we'll definitely leave some time at the end for you all to ask questions as well. The webinar is being recorded, so all registrants will receive a follow-up email from the CTRJJ, so look out for that. And there will be a certificate of attendance that's available for download at the end of the webinar. So it is for personal use, not eligible for CE credits, but we will share a QR code where you can access that at the end. Okay, so as I mentioned, my name is Carly Bates. I am a clinical psychologist and associate professor of psychology. I've worked for many years in the juvenile justice system in a variety of roles. And I always like to start off these webinars for those who have joined us before, really grounding us in youth voice. So really thinking about all the work we do and why we do it. As many of you know, our resource was released back in August, so we've received a lot of positive feedback. We're really excited that people are using it. And we really find it helpful to really break it down into these smaller chunks and focus more intently on some of the areas that we've covered in the resource. So we're going to focus today primarily on screening and assessment. As Malika is saying here, I think, this is really true for many of the kids who interact with the juvenile justice system. And I think what we're focusing on today really squarely focuses on this challenge. In order to really address the root causes for youth, we need to know what they are, right, and what they're experiencing. So that's what we're going to be focusing on today. So just to orient us to the overall resource guide, for those who haven't had a chance to engage with it, there'll be a QR code at the end where you can find out more information, and I highly encourage you to check it out. So this guide was really designed to provide information mental health providers who are trying to better understand the criminal justice system, or who might be working with youth who are in the system already, and want more information and want to feel better equipped to really work with kids and understand what they're experiencing while system involved. So we have a variety of different modules with a lot of information, and we've focused our first two webinars on more of sort of an overview and an introduction. And then today we are actually going to be focusing very specifically, as I mentioned, on screening and assessment. So there are a variety of different ways, right, that mental health providers might interact with screening and assessment in the juvenile justice system. So for example, you might be a mental health provider who's working within a system setting, such as detention. You might be a community-based mental health provider who might be working in collaboration with or receiving referrals from system players to work with youth. You might also be a community-based mental health provider who's working with a particular youth who then becomes involved in the system. So screening and assessment, regardless of what role you're in, screening and assessment can and does function very differently in the juvenile justice system as compared to the mental health system. So we're going to spend some time briefly highlighting those differences today. But for the bulk of our time together, we're really excited to center the conversation in the real world. So you're going to be hearing from two leaders from the Nebraska juvenile justice system on how they've effectively incorporated screening and assessment with probation officers and clinicians in their system. So just briefly, and for those of you who joined us on the last webinar, you'll recognize this very complex graph of the system and really highlighting again, right, what youth and families are often facing during with the system. It's really confusing. So I just wanted to highlight very briefly before we start talking specifically about screening and assessment that it can occur in multiple time points across the continuum. All right. So a screening and assessment might take place before arraignment or first appearance. It might take place when a youth is detained, right? So when they enter detention during that intake process. It may often take place right before a disposition hearing, before that disposition or sentencing. And then it also could take place after disposition, right? When a youth, perhaps the dispositional order is for probation or residential treatment facility. So there are a variety of different points across the system, and a youth might actually be engaging with screening across all of these different time points. And in the system, it can also be screening in particular could be administered by a variety of different professionals, right? So you might have probation officers who are screening youth. You might have mental health professionals, case managers, medical professionals, social workers working with attorneys. So a variety of different players could also be engaging in screening and assessment within the system, which is a bit different than in the mental health system. So just briefly, and our resource guide really goes through this in much greater detail. So I'm just highlighting for you here a couple of pieces. So there are a couple of different types of screening and assessment measures within the juvenile justice system. Mental health, right? Screening and assessment. The purpose there is really to identify a youth's mental health needs, developing a treatment plan, identify mental health related risks, and really determine maybe which youth might need a more comprehensive assessment. And then risk assessment is another type of assessment that's very different. The purpose here is really to evaluate a youth's propensity for future offending, identify factors and potential services that could reduce this risk. Risk assessment is also used to determine a youth's level of care before or after adjudication, or also thinking back to that continuum, focus on informing that dispositional or service plan. So both types of tools might be used in JJ settings. Um, and it's really, though, to think about what some of the differences are between the mental health system and the juvenile justice system. So there are some common challenges that mental health providers often encounter when working either within the juvenile justice system or even adjacent to the system. So one of the first is that as providers, as mental health providers, we are often using screening and assessment to better understand a youth's symptom severity, right? Make diagnoses, inform treatment plans, and think about what kinds of services and treatment would be best for this youth. In the juvenile justice system, that may also be happening, but the system itself is much more focused on linking screening and assessment results to strengths and modifiable risk factors. So when you're working with the system or with players in the system, that you're really able to communicate back to the system about the relevance of the information and how that's relevant to a youth's involvement in the system and maybe those dynamic risks. Collaboration with system players can also really support more effective case planning, right? And sometimes this is different for mental health providers, right? Or even on the other side for the juvenile justice system, right? We're not always used, we can be very siloed. So we're not always used to that collaboration and communication, but it is so important. And I think our panelists today are going to talk a little bit more about how they've been able to navigate that successfully. Another area that sometimes comes up that can be a challenge is that sometimes judges will mandate a type of treatment for a youth. And we know as providers, right, we want to be able to make that should be our clinical decision and really be able to make that determination after doing a thorough assessment and understanding what that youth needs rather than it being more of a one size fits all. And I think this is often very well intentioned on the part of judges, but can be frustrating for providers. And then finally, the mental health and the legal system are often coming from two different perspectives, and their timelines are often not aligned, right? So, from a mental health perspective, when we're working with a youth, we might be doing work with them for a long period of time before we can expect to really see improvement and change. And we know for many of the youth that we're working with, They have been through so much. And so that just doesn't change overnight, right? But for the legal system, they're working on a different timeline, right? And so that can often be a tension when mental health providers are working with justice system players. So, what we really want to spend the bulk of our time today is hearing from people who are really working in the system. So, we're really excited to have Erin Curran and Lindsay Meyer. And Erin is a juvenile director within the Administrative Office of the Courts and Probation, Juvenile Services Division. Erin holds a bachelor's degree in behavioral sciences and master's degree in clinical counseling from Bellevue University. She started her work with probation in District 2 as a high-risk juvenile probation officer in January of 2017, and then she transitioned to a juvenile treatment officer. During that time, Erin served as the juvenile court officer in Sarpy County, working with youth with significant substance use needs. Erin has served on several community-based committees and was a statewide trainer for Question, Persuade, Refer, Trauma, and Resiliency. Prior to joining probation, Erin worked as an intensive family preservation therapist with KVC Nebraska, as well as an outpatient therapist with Behavin' Kids and Beneficial Behavioral Health. Erin's career has focused on supporting youth and families involved in the court system through delinquency or abuse and neglect cases. In her time as an intensive family preservation therapist, she also was a treatment provider working with Sarpy County Juvenile Drug Court. Erin's passion is to work with justice-involved youth and to afford them every opportunity to connect to resources and help them be successful in their lives. In her current role, that work has shifted to supporting the best practices and programming for youth involved in the juvenile justice system. And Lindsay is the Juvenile Justice Reform Specialist within the Administrative Office of the Courts and Probation Juvenile Services Division. Lindsay obtained a bachelor's degree in social work from Nebraska Wesleyan University, and she began her work in this field as a high-risk juvenile probation officer in District 3J in Nebraska, working with a wide variety of youth who presented with significant risk, needs, and responsivity struggles. Lindsay joined the administrative office in July 2021, and in her current role, she oversees implementation of enhancements to juvenile justice system guided by best practice research and recommendations made through the probation system review conducted in 2021 and 2022 by the Robert F. Kennedy National Resource Center for Juvenile Justice. Lindsay's passion is seeing the potential in all justice-involved youth and supporting our justice system workforce. So we're going to be hearing from Erin and Lindsay, and Dr. Keith Cruz is going to be our moderator for this panel. And Dr. Cruz wears many, many hats, too many to mention here, but he is an expert in screening and assessment of kids in the juvenile justice system. He's a professor in the Department of Psychiatry at Fordham University, and he is the co-director of this center, CTRJJ. So I'm going to stop sharing my screen now, and I'm going to turn it over to Dr. Cruz.
Thank you, Carly. It is a real pleasure to be here. And one of the, Carly had mentioned that, I wear many hats in addition to the co-director for the Center for Trauma Recovery and Juvenile Justice. But I've had the honor and privilege of working with the Juvenile Services Division for over 4 years and offering them some consultation and guidance around their use of screening and assessment processes. And that's what we're going to discuss today, with through a little Q&A. It's really going to build off of, and I think offer some really great examples of some innovations that are really anchored in many of the points that Carly mentioned. So welcome, Lindsay and Erin. I thank you for agreeing to share your experiences with us today. And I think what I'd like to do is just to, start and get us kicked off by offering a question to you, Lindsay. We know that mental health screening by juvenile probation officers in Nebraska it's part of probation's responsibility to conduct post-adjudication and predisposition investigations. And the Juvenile Services Division over the past 4 years has made really substantial and significant commitments to enhancing probation officers' use of mental health screening. And it's through the TRACS process. And can you briefly explain what TRACS is and what enhancements the Juvenile Services Division has recently made to screening?
Yeah, you bet. Thanks, Keith. I wanted to say too, hello to all the folks on the webinar from Nebraska. I think that's really cool to see. So wanted to just highlight that. So yeah, I'll talk a little bit about what TRACS is. So TRACS is a rebranding and practice model we've created here in Nebraska. TRACS stands for Targeted Responsive Assessment for the Court is Key to Youth Success. And this is a practice model that we, like Keith said, have been partnering to create over the last 4 years and launched back in December of 2024 in a staged-based manner across the state, and just finally finished in all 12 of our probation districts in September of this year. And this practice model really was created to, like I said, rebrand and enhance our predisposition investigation process, or our PDI process, and really for a couple of reasons. And one of those is to really aid in and reinforce our commitment to the risk need responsivity, or R&R model. And the decision to really take this on and tackle this was born out of our desire to enhance our just simply trauma screening, which was one of the recommendations that was given to us via our probation system review that was conducted back in 2021. So when we embarked on kind of exploring a trauma screening process and what that might look like, we ultimately landed on enhancing our behavioral health screening as a whole and situating that within our predisposition investigation process. So TRACS is that model, the model by which we use to guide the investigation process and complete behavioral health screening. TRACS includes evidence-based behavioral health screening for all youth. And we've chosen, with Keith's consultation, the MAISY-2 and the Child Trauma Screen, or the CTS. And so those screens are conducted with all youth through the investigation process. And one, I think, key component to tee up here as well is we've built timeframes into our process, which really supports timely and really urgent identification as soon as possible following adjudication of a youth's potential behavioral health concerns, and then allows us to follow up in a timely manner as well.
That's great. Thank you, Lindsay. And then, so that really describes a really critical role that probation officers have in TRACS. And what role do community mental health providers, have in the TRACS process? And what enhancements, did you think about or build into TRACS to really enhance that communication and information sharing between probation and those community providers?
Yeah, so providers have a significant role in the process and a significant role in our ability to really analyze risk need responsivity and provide that analysis to the court. So one part of the model that we've developed is a triage tool, which helps probation officers really analyze the results of the behavioral health screens, so the MAISY and the CTS, and then make decisions on how to follow up based on what those screens said. And though the decision-making guides the probation officer as to, first, if follow-up is necessary, and then second, what kind of follow-up via a mental health evaluation, co-occurring evaluation, or substance use evaluation. So then that decision is communicated to an identified mental health provider via our evaluation referral form. And that process of communication summarizes what was found in the behavioral health screening process via a grid that kind of summarizes the results in a succinct manner, as well as a narrative option for the probation officers to describe some of what they learned during the screening process. And then additionally, and something that I think kind of sets this referral form apart from our earlier process, is we've included on the referral really a focus on requesting that the mental health provider examine and articulate how the youth's behavioral health needs are impacting their delinquency risk. So really making that ask ahead of time, and then partnering with the provider to aid in that analysis. So really, bridging the gap between the clinical perspective and our criminogenic risk analysis, so that we can provide that perspective for the court.
That's great. Thank you, Lindsay. And Erin, we want to bring you into the conversation as well. As Carly mentioned this, and as did Lindsay as well. A judge will often order this predisposition investigation for youth, after their adjudication. And that might be comparable to what we might think of as an assessment, right? But it involves probation officers interviewing a youth, a parent and caregiver, reviewing records, scoring that risk needs assessment, as well, and then writing a report. And Erin, could you even just elaborate on this a little bit more? What do you think is important for clinicians to know about the purpose of a predisposition investigation report, when it's submitted back to the court, and how that's different from a clinical assessment?
Absolutely. Yeah, so Lindsay kind of talked about it in the last question around that risk needs responsivity. And that's really, it's intended to be a comprehensive look at that youth and family system for this juvenile so that we can target the right interventions to address their delinquency needs. And I think that historically responsivity has always been a factor in that, but not always highlighted in the way that was meaningful and helped really get at that baseline for kids, right? So when we look at an evaluation, that also is a comprehensive, or an assessment, that's a comprehensive look at a juvenile as well, that is very much incorporated into our predisposition investigation. So when we look at those pieces of that clinical assessment, that in and of itself isn't enough for what the court's needs are, but that link to the delinquency is really that key piece that helps us say, listen, we have this kind of issue that's impacting this youth and or family system, and this is what it means for their delinquency and their risk to reoffend, and how do we help target those things? And I just think of, when we look at especially treatment needs for juveniles and adults, we often previously missed the mark when it wasn't targeted, right? So we would have times where we were kind of like, we know we need something, but this process has really helped us narrow down within that predisposition investigation of, this is exactly what we need and why, and what it means for that youth to decrease their community safety risk and increase their positive outcomes overall. And so I think it's just been a really nice progression of how we've kind of shifted our focus with how our providers in the community are doing those evaluations to really help assist us in laying out that clinical piece, because that's not our staff's world. So saying this is exactly how we need to build that treatment focus to help support them on probation overall, and knowing these are factors we have to address for them to be successful.
Yeah, and Erin, and maybe you just kind of want to build out on that, a little bit more too, is because, if probation through the tracks process would request an evaluation and the court would support that as well. Can you just talk a little bit about that court communication that occurs? And how, because I think it may be helpful for providers to really kind of understand all the behind the scenes that can occur from within the court in order for an evaluation to even be requested.
Yeah, absolutely. So as Lindsay kind of highlighted, we do that early process to do the tracks process and identify what evaluation they may need, and then the court will approve that happening. We really work to communicate with the provider and get that referral sent. And to give as much information as we have at that point to be able to provide you with everything you need to do a comprehensive assessment of that juvenile. And then when we get that back, historically, it was just kind of attached to our investigations and not a lot of context was drawn, which is great for people that know the clinical world, not so great for people in the court system that maybe don't. So now within our investigation, we definitely take that still attached as a supplemental document, but then we actually work through the staffing process with the provider to kind of talk through the evaluation and understand it, to be able to say, this is the elements that we're putting into our investigation to say, this is what the assessment from the evaluator actually means, versus just attaching it and hoping people can draw those connections for us. So, why these levels of severity are impacting this youth, how they are, and what we do with that. Does that answer what you were thinking, Keith?
Yeah, I think so. Yeah. And Lindsay, could you tag in here as well? Is because As Trax was launching too, there was a lot of challenges in thinking about how probation would communicate with the courts and court partners about when an evaluation could even be done. Can you talk a little bit about that on and even the front end before that referral can even be sent to a provider?
Yeah, you bet. I think Carly mentioned it a bit in her opening slide around, oftentimes and sometimes just because it's the established practice that some of these decisions around treatment type and evaluation type perhaps were historically being sort of mandated or decided by court partners. And so of course, as I described earlier with the Trax process, we're really trying to shift that decision making to the decision around if an evaluation is necessary and what type, guided by our screening process that we're doing here at the probation office. And so really, we knew that if we were going to shift some of that, it was going to require some intense communication with our court partners across the state to say, well, one, educate them on our process and the credibility of the tools we're using to help guide these decisions, and then describe the process that will help us make the decision. And then really, it's about sharing what the screens are saying with the court and why we're recommending a particular type of evaluation, and then allowing the court to give us authorization to move forward with that. And we're seeing that kind of play out a couple of different ways across the state, depending on court and judicial preference. Some courts and judges are sort of okay saying up front, probation, complete your behavioral health screens, and then go ahead and refer for an evaluation as indicated by those, where other courts and judges prefer for us to go ahead and screen and then alert the court to what the screens are recommending. And then based on other court parties, county or city attorney and defense attorneys, their position, and then giving us authorization to proceed with that. But I think sort of moral of that discussion is that court authorization has to occur. And so we've been working to build some of that trust and credibility in our process to help guide that court decision making.
Yeah, that's really helpful, and I think it's just really important for providers to know that things don't happen, in terms of referral for an evaluation, for example, or for an assessment, often without court authorization. And this could vary across different jurisdictions, but this is the model that is utilized in Nebraska. And it also is a great example that there is some flexibility and individual district variation in how those authorizations are completed. And in one way, sometimes it almost occurs almost like an MOA or an understanding between probation and all the court partners that the probation department can order this. And others, it's going to be an individual decision that needs to be made in consultation with the court and court partners. That's really great. And the one thing I will just offer in terms of commentary, because I cannot not comment around this, is in my experience, and I think Lindsay and Erin, you could speak to this as well, is that when judges or the other parts of the system were often requesting evaluations in the absence of this sort of targeted screening, they were maybe trying to think that, maybe we'll get an answer through this evaluation, or what's happening, what's going on with this particular youth, and ordering evaluations in a hope that was going to produce some meaningful information for the courts. How have you seen sort of dialogue and discussion across your system change, and since you've been implementing Trax?
Yeah. So I think, it's a sort of long-standing ingrained practice that takes time to adjust. And so we've been really supporting probation districts in continuing those exact sort of types of conversations with judges and court partners. And one of the most frequent sort of piece of anecdotal feedback we've heard from districts who have talked to their local court partners is that sort of the relief might be the right word to say, oh, you mean I don't have to make this decision? You've got some tools that can tell us what might be best. That's great. Because I think, folks are doing the best they know how with the information they're provided at the time of the, information in front of them. And, saying, like you said, Keith, I think an evaluation might be helpful here to tell us what to do. And so we've really said, well, we've got some tools that will help us decide that. And there's been some sort of comfort in saying, okay, we've got some, structure and decision-making tools to help us decide what to do versus, kind of guessing, for lack of a better way to say it.
Yeah, that's great. And Lindsay or Erin, I think either of you could comment around this, but Erin, you kind of queued this up for us already, is in the tracks process, this after an evaluation is requested by that community provider. There's the challenge of integrating that into the overall investigation. And again, and you all were, I think, really innovative in developing, as part of the tracks process, this idea of an integrated recommendation discussion, or the IRD. Can you kind of unpack that a little bit more and describe why you felt it was really necessary to include this integrated recommendation discussion as part of tracks?
Yeah, and I'm happy to start with that one if you want, Linz. And having come from both the provider world and the probation world, right? It's different because I have clinical knowledge as a probation officer when I was in that position, but most of our staff doesn't. So that integrated referral discussion, or IRD, has been helpful in how to bridge some of those language gaps of how to explain why is this impactful? Why does this matter for this youth and family? And giving us the language to be able to also share with the court and really understand why the evaluation or assessment has come to this conclusion, right? So sometimes I think it felt very segmented in the way we did it in the past, of just, we would get information of providers, we may or may not have a conversation, and then we pass it on to the court. But then that probation officer is in court expected to speak to it. And if we don't have these discussions, they don't have the information they need to really support the decision. So that IRD process has really helped us be able to, one, make sure we have all the correct information at the time, because we also know things can change very dynamically with kids. So you might have completed the assessment a week ago and something has happened that really could potentially change the course of diagnosis or treatment options. And then beyond that, making sure we're all aligned with what next steps are, and if they are available is also a big deal. We know everywhere, but certainly in Nebraska, do we have access to that in a reasonable time frame that helps support that youth success? Or do we need a secondary plan, because we don't expect providers to know what kind of wait lists there are for every single facility in the state. That's more our job. And then how do we communicate this meaningfully to the court and court parties and our stakeholders of how to help use this information as a part of that bigger plan for youth success?
Yeah, and Lindsay, and maybe I'll piggyback on that, could you talk a little bit about the training that was offered to probation officers on how to engage, and do you have any practical examples of what this IRD actually looks like in terms of probation officer and provider communication?
Yeah, you bet. So I'll talk a little bit about sort of where this fits in the larger process. So really, the integrated recommendation discussion, the planning for that begins early as well. So when we've written into our process and timeframes that when the screens indicate an evaluation is necessary, and we go ahead and make that referral to a community provider, that during that referral exchange where the provider says, yep, I can do that for you, and you're talking that through, we are scheduling this integrated recommendation discussion at that time and saying, okay, in 3 weeks, or an appropriate time frame, we're going to meet on Tuesday at 12 o'clock for 15 minutes and have a discussion about what you're thinking about putting in the evaluation. And then that discussion happens before the evaluation is even submitted to us in writing. And the discussion, we, allow flexibility around that, because I know providers are worried about time and want to be efficient with their time, certainly, right? So can be phone or virtual, but we prefer a conversation, of course, and it can be brief, 10, 15 minutes. And we've developed an integrated recommendation discussion guide that probation officers have, and we've shared with providers and encourage sharing with providers to help guide the discussion and cover sort of, what are you seeing and what are they seeing? Maybe any discrepancies in information shared. Talk about kind of what recommendations are being thought about. and guide that conversation to connect those behavioral health symptoms or needs to that delinquency risk. So we really describe it in our training to probation officers as, you know, kind of giving equal weight to the conversation, that we're both experts in our respective fields, the clinical and the criminogenic risk, and bringing those together in that discussion to really get the best product for the court. And also certainly, you know, we've had some questions around, well, what does it look like if probation and maybe the clinical provider don't agree? That's okay, right? We're not necessarily trying to persuade or change, but just come to some sort of understanding and have some of that discussion ahead of time. So if there is disagreement, we can at least have some understanding there. So we, as like I said, as far as training, we've developed that guide and also recorded a mock version of this for probation officers to watch, to see an example of that. So trying to support just increasing sort of their skills and confidence in partnering with community providers when they refer for evaluations.
That's really great. And I think too, is, you know, as a clinician and someone who's worked within the system, I think just that basic ability to communicate and really understand, well, what does this diagnosis mean? And what are those key symptoms? And you're recommending this treatment. Oh, may not be available. Can we discuss a plan B before we commit to that in writing, right? And then bump into challenges. This is one of the greatest things I think about the tracks process. And, you know, in terms of an innovation. But let's pop back, Erin, to those timelines, right? That Carly mentioned as well. In Nebraska, there are things of what are called court progression standards. What the expectation is that a youth will move from adjudication to disposition in 45 calendar days. And this puts a lot of pressure, not only on probation, but also on clinicians to complete an evaluation based on those standard referral questions very quickly. How are you all navigating this 45-day process? And, you know, are there things that you all are doing through probation as a way to try to support clinicians in being able to sort of participate and ensure that the system is staying in compliance with those core progression standards?
Yeah, absolutely. So really, and it's tough. It is a tough time frame when we're talking about 45 days. And the intention is really to ensure that timely process for a youth, right? That we're not lingering in wherever they might be, alternatives to detention, things like that. But it is a quick turnaround for clinicians. And so what we really try to do is, with that referral process, we have put in place those timelines for us to get the referral information out right away to the clinicians, to be very upfront about, hey, we need this back in this time frame. So usually it's a 10-day time frame that we ask for clinicians to turn that around, but we also help support setting up referrals. So we, in some places and in some areas, we were doing this historically, where we kind of give family a list of providers and say, call these people to get it set up. And that's just not really an effective means for anyone, especially if you've never been somebody that's used the mental health system. It's really scary to call someone and be like, I don't even really know what I'm asking for. I was just in court. So we really help connect families with providers, still allowing for family voice and choice, but it also helps us to be able to assist with payment when we're looking at providers. So we really help set up that initial referral. We do help with scheduling and making sure that families have follow-up on when their appointment will be, and sometimes can even provide transportation for the youth for evaluations when that's a barrier as well. And really making sure we have as much comprehensive information for the clinician at that point of referral, and really trying to cut out some of that timeline on work for them. Because if we can provide some of that up front versus them having to go gather all this information, it really can save some of that time and dedicate their time to what's more important, which is that communication with youth and family and any other collaterals that they might need to do. And then certainly we're the streamline to communicate back to the court. If there are barriers in place, we're trying to help with that. And then ensuring that if they need more time, we communicate that back to the court as well. And sometimes that does happen because things change or something comes up, or we find out there was a concern that no one had awareness of, that we maybe need to shift the direction a little bit We do make sure we're communicating to court parties on that piece as well, because while the goal is to get the assessment and our investigations back in a timely manner, the goal is much larger of quality evaluation, assessment, comprehensive look at this youth. So we're ordering the right services and everything. So we'd rather take a few extra days if we have to get the right things in place. But generally speaking, we're sticking with those timeframes pretty well within this process, which is a great thing to see. And Lindsay can probably speak to more. It's just really helped kind of organize the process, where before it was a little bit scattered and different across our state.
Yeah, Lindsay, anything else you'd like to add to that?
The only thing I think I would just underscore is the relationship between our local probation staff and these providers. I think has also been a major sort of contributor, or when we have had success, sort of that common denominator of just building relationships, helping providers understand the why of our timeframes, being flexible if we are able to, kind of like Erin described, being clear and communicative up front. All of the relationship and communication piece, I think is a big component to that.
Yeah, that's really fantastic, right? And when we think about those broad principles of trauma-informed care at the systems level, or even this idea of, like, Erin, you use that word, voice and choice, right? Et cetera, with this, is the faster that evaluation can be completed and this conversation, and we're talking too about trauma-informed principles of cross-system communication and collaboration. I think what you've both been speaking to is a great example of this. But getting that information early then actually allows probation officers to have a conversation also with the youth and families themselves about what's going to go into that PDI. And I'm just thinking about that now. Lindsay, can you speak to that a little bit, and how you see that process working in tracks?
Yeah, that's a great point, Keith. And one of the, we didn't talk earlier, but a key, I would say, component to our success of the implementation of this model across the state has been the development of a success statement. And a piece of that is our focus on enhancing youth and family engagement through the entire investigation process. And we have a multitude of sort of ways we've infused that throughout the process. And at the beginning of the process, with Keith's help, we've developed a dialogue sheet, which is essentially a script, right, that helps probation officers administer our tools. But one key component of that upfront process is pausing to engage the youth and family. Do you have questions? Are you okay with moving forward? Just simply, giving them the opportunity to make a choice in that, and also sharing with the youth and family right away the results of the screens and how we intend to move forward, or how we suggest moving forward, and if they're okay with that. So we infuse it right there at the beginning. And then also throughout, but then moving to the end, once we've received the evaluation back and before we are submitting our investigation to the court, having a conversation with the youth and family, again, preferably over the phone or in person, to explain what we are recommending, ask them their thoughts, and not necessarily always come to an agreement, but give them the opportunity to share their thoughts, share what they think would work for their family. They know best, right? And share how we're integrating that evaluation experience they had and help them understand how that all comes together. So again, really lifting up the importance of youth and family partnership and voice throughout the entire process. And I think we've been pretty intentional about giving points to do that.
Yeah, and it all comes back to that collaboration between the probation officer and the provider, and getting this done in a timely manner with these components so that conversation can happen. And I just wanted to uplift that because I think as providers, and I think maybe when I was early in my career, I kind of had the misunderstanding of, I write the report, I submit it back, and you don't sometimes know what happens with this as well. So it's really important for providers to really understand that these discussions about their recommendations may be part of the discussion that occurs during that disposition hearing, that the probation officer is actually communicating that information to the court, not only in a written report, but then the youth and the family are going to hear those recommendations. And sometimes that could involve like a diagnosis or a recommendations for treatment. And that can be very destabilizing or alarming for a youth or a family to be hearing this information like for the first time, in the context of a very stressful disposition hearing. And so I think that's just kind of important to lift up, and I applaud you all for being very intentional about how to try to diminish that from occurring during this disposition process, while also working to try to engage in some more, family engagement and collaboration. Briefly, because I think we've seen some good questions maybe coming in here as well. But Lindsay and Erin, I kind of want to give you the last say here with having gone through this process of developing and implementing tracks, this enhancement of screening and the assessment and the probation clinician collaboration. Any other lessons learned? And this may be even like anticipated outcomes and maybe even unanticipated outcomes that you'd like to share, having been working on this for 4 years and really implementing it very intensively over the past year.
I can share a couple first. I think just the biggest one in terms of this particular topic in this part of the process is, again, just that importance of partnering with your local probation staff and office. I know that, like Keith said, sometimes it sort of seems, ambiguous or kind of unsure of what the process looks like, but partnership and relationship between probation and provider is critical throughout at the initial, stage, and then even ongoing once you're working with a youth, maybe in a treatment capacity, that continued relationship and communication is so important. And I say that because where we've seen the success of tracks, expedited has been where those relationships have been strong or have been cultivated. So I just think that's really important. The other thing too that kind of comes to mind and that folks may be wondering about is we had this question from our own staff is, how will this impact maybe the rate of evaluations? Will they go up or down? And what will that look like? And we really haven't seen any significant impact on the change in evaluation rate. I say that also we're still early in implementation and still certainly monitoring all of that. We have districts at various stages of implementation, so that could over time perhaps change, but our provider network has been able to manage the referrals we've been providing them. So I think that's kind of important that we're keeping a kind of a pulse on that, the rate at which this might be impacting evaluation referrals and our provider capacity across the state.
Yeah, I would agree with what Lindsay said, that the relationships that we have with our providers at a local level is so crucial to us being successful, and then our youth and families. And I see that having been on both sides of things, of just how we can't do it without one another, but we haven't always historically brought everyone to the table for the purpose of like that role clarity and that stakeholder engagement and feedback. And I think that's been great because we do have this group of providers that have provided a good amount of feedback to us about the process and, hey, maybe this isn't working well or what has been going well. So that's been invaluable. And I think something that will translate to a lot of different areas with our work, not just with, assessment and investigations, but with ongoing services and how we've shifted a lot of our focus against other programs as well, to just really look at how do we make that meaningful look at things. And then I think that the other piece for me is that importance of that plan for implementation so that we could do it right and work out the kinks, because they're there and they will always be there. But how do we do this in a meaningful way that really tried to think through all the pieces so that once it got to the point of really being at the point of families and youth being involved, they didn't have to feel all of the kinks being worked out, which sometimes is how systems do it. And so I think that's been extremely helpful for us, and hopefully our clinicians that we work with closely also feel some of those things being smoothed out that maybe were hiccups in the past as well.
Yeah, that's fantastic. Erin and Lindsay, thank you so much. I'm seeing, some additional questions pop in here too. And so we want to take at least 5 minutes to maybe try to respond to a few of these. And Carly, I'll let you cue this up. But I noticed that one question that emerged in the chat was, is the system tracking and aggregating data metrics from really, I think it's from the tracks process. And without going into details, because Charles, that is a much longer conversation than we can accomplish in 5 minutes. But I will just take this and say that it's been very, very impressive that the Juvenile Services Division has committed to a plan of quality assurance monitoring of this process. And there's been a very intentional structuring of data metrics. Not only just in terms of quantitative metrics, what are we learning from the screening tools, but also more qualitative metrics as well. As Erin just mentioned, intentional communication with the partners and the stakeholders as well. So there's a very elaborate process. And as you've just heard, there's so many moving parts from screening to assessment that could be done and to evaluations that the metrics are really important to ensure what's working well and what needs to be tweaked. Let's see, Carly, do you want to queue up any of these other questions?
Sure, but just wanted to also just thank you both so much. It's such a powerful example of seeing trauma-informed care practices, really seeing a system take those trauma-informed principles and put them into practice. So thank you both. So yes, a couple of other questions that have popped up. So has this process helped to decrease the time that youth are held in detention? Have you seen any effects there?
I can jump in quick, and then Erin, if you want to add anything. We haven't necessarily looked to make that connection exactly yet. I think, and Keith, you might comment on this as well. I don't know that we're far enough along yet to make those connections in terms of assuring that the process is being delivered across the state as designed first is really our focus in terms of monitoring implementation. And then once we can assure that via our strong QA and CQI processes, then we can start to make some of those connections around what are the larger sort of impacts and outcomes this is having on young folks' experience in the justice system. So haven't made that connection yet, but maybe more to come when we kind of draw those at a later time.
Yeah.
Yeah.
Erin, do you want to comment on that as well?
No, I was gonna say we're pretty early for that outcome to really say that it's directly impacted by this, because we've done some other work in trying to expedite, especially youth in detention. And really, we have laws that say they shouldn't be in detention awaiting evaluation, and that's not always how it's followed, right? But so we've done other work in that area, so it's a little hard to make that conclusion, but I think that we are seeing good accountability and things when it comes to providers' willingness to go into our detention centers and do those evaluations. Thankfully, we've always had a pretty good group that will do that, but we've even seen that just a little bit better now of, yeah, we can get in there and get it done just because they know the information ahead of time. Because as much as it's easy to get the kid, it's not always easy to get the family in that situation. So.
Yeah. And the other thing I would just point out too as well is that with that is, and I think we touched upon this in one of our last calls, another aspect of screening and assessment that will occur in most systems is a detention risk screening tool as well. And sometimes the outcomes of that tool will be dependent and inform a judge's decision on whether to keep a youth in detention or not. And that just can be a whole other level of screening in addition to mental health and behavioral health screening that might be occurring as well. Then we're getting short on time, and I see that one practical question is, can we share the actual screening tools used for tracks? I will just say very quickly and practically that Carly has included a number of resources in terms of common screening and assessment tools in the resource guide, but specific to the tracks process. The child trauma screen is the behavioral health screening tool. And if you Google the CTS or the child trauma screen, you can find an access point. It's a publicly accessible tool. And the other mental health screening tool is the MAISI, the Massachusetts Adolescents Use Screening Instrument. It is a proprietary tool, but that can also be Googled, and it will take you to an organization called the UMass and the MAISI Help Desk. that where you can obtain information about the Maisie 2 as well.
Great. Thank you so much, Keith. And thank you again to Lindsay and Erin for all of this wonderful information and for everybody who's joined us today. I'm going to go ahead and just share my screen briefly here so we can close things out. We want to be able to provide you guys with some information about our upcoming webinars. So this is the third in our series. So our next one will be on January 9th, where we'll be covering interventions that are commonly used in the juvenile justice system. And then in March, we'll be talking about tips and strategies for mental health providers. So please come join us. Scan this QR code to connect with the CTRJJ. So this is where you can find our webinars, and you can also find the resource guide as well as many, many other things. And I also then just want to make sure that people have an opportunity to access the certificate for the webinar today. So thank you all so much for joining us. Thank you to our panelists. Thank you to Dr. Cruz for moderating our question and answer. And we hope to see you all in the next webinar.
Thank you, everyone.